So now let's change gears and talk a little bit about what fertility preservation could look like for you, depending on what kind of reproductive organs you have in your body. So for individuals with male body parts, there are three primary forms of fertility preservation. The first is called sperm cryopreservation, also called sperm banking or sperm freezing. And this is the most common method for fertility preservation in this population. So the advantages of this procedure is that it's very safe and non-invasive. Essentially, you have to undergo a couple of screening blood tests, and then you present to a facility and provide a sample. Usually you have to provide a few different samples on different days to ensure that you have enough sperm to be frozen. But otherwise, there's no procedures, there's no additional medications. It is relatively easy compared to other fertility preservation methods. However, to use your stored sperm, you will have to undergo in vitro fertilization, or at least ex vivo fertilization prior to intrauterine insemination. So essentially what that means is if the sperm exists outside your body, they have to be sort of reintroduced into a partner's body in order to develop a new embryo or a new child and to have a successful pregnancy. So there will be sort of down the line, if you end up wanting to use your sperm, additional procedures that are required in order for you to make that happen. The second option we have on the list here is testicular sperm extraction, also called TEES. This is an option if when you go to present with a sperm sample, there's no sperm present in your ejaculate. And this procedure is fairly similar to what it sounds like. Essentially, using a surgical technique, they are able to go in and actually withdraw sperm from the testes and then go about the process of freezing them. So the advantages are, if this is your only option after you've tried sperm cryopreservation and that hasn't worked, this could be successful. The disadvantages are, it's a surgical procedure, and down the road, you're still going to need to undergo IVF. The final option here on our list is testicular tissue cryopreservation, and this is really helpful for those who are unable to produce sperm via the other two methods, and is often used in children who are prepubescent, so young patients who are too young to really produce a sperm sample and are unable to undergo sperm extraction. And I would highlight here that this is still an experimental method, which means that it's not offered in every institution in the country, but would still be offered under experimental trials in many places.